Coronavirus cases are on the rise again. The World Health Organization says the Omicron variant of COVID-19 has likely reached every country at this point. The CDC says the variant makes up 3% of U.S. cases, with Delta still responsible for the majority of infections. The U.S. is averaging nearly 119,000 new cases per day and 1,300 deaths. The rise of infections is becoming apparent in everyday life. At least 6 Broadway shows in New York City have canceled performances. Cast and crew members are getting infected with the virus. In the NFL, approximately 100 players have tested positive over a 3-day span this week. And schools across the nation are seeing surges in cases, forcing classes to go remote ahead of the holidays. Dr. Anthony Fauci says the good news is booster shots are effective against the Omicron variant.
Our booster vaccine regimens work against Omicron. At this point, there is no need for a variant-specific booster. And so the message remains clear. If you are unvaccinated, get vaccinated, and particularly in the arena of Omicron, if you are fully vaccinated, get your booster shot.
And we want to bring in infectious disease specialist and epidemiologist at NYU and Bellevue Hospital, Dr. Celine Gounder. Dr. Gounder also served on President Biden's Transition COVID-19 Advisory Board earlier this year. Dr. Gounder, thank you so much for joining us. Great to see you. Dr. Fauci says there is no need for variant-specific boosters. Do you expect that guidance to change in the future?
Based on what we're seeing, I do not expect that guidance to change. What we're seeing is that you can override that relative immune evasion, that relative resistance with Omicron by giving an extra dose of vaccine. You result in a higher level of antibodies, and so you can override that relative resistance by boosting up the levels of antibodies.
Now, a couple weeks ago, you said on another program that you were concerned about the Omicron variant, but you were not panicking. Do you still feel that way?
I do, but we do need to take certain measures. We have the tools at our disposal to handle this, but we need to use them. So that means everybody needs to get vaccinated and boosted. We do need to prepare our hospitals for what will likely be a surge in cases and hospitalizations. So that means putting a pause on elective surgeries, for example, so that you have all hands on deck. As for the average person, you should be layering other measures. So that means masking, especially when you're indoors in public spaces. Up your mask game, use an N95 mask or a KN95 or KF94 mask. Those are better than the surgical and cloth masks. And then really optimize the ventilation and air filtration in indoor spaces. Open doors and windows. Get yourself a HEPA air filtration unit if you don't have one. Put those in the living room, dining room, kitchen, other common spaces. Those are all great ways to reduce the risk.
Now, in New York, I mentioned Broadway shows canceling performances. Some restaurants have temporarily closed. The White House COVID-19 response coordinator says there is no need to shut down the U.S. economy to fight the virus. What do you think about that?
I would agree with Jeff Zients, the White House COVID response team coordinator, that there is no need to shut down the economy in response to Omicron. Again, we're in a very different place from where we were in March of 2020, where we didn't really know how the virus was transmitted. We weren't sure which tools would work. We have a lot of tools now at our disposal. We simply have to make use of them. And for the average person, if you are not yet vaccinated, if you are not yet boosted, now is the time to go out and get that shot.
That being said, you mentioned masks, you mentioned putting filters in our homes. What are your safety recommendations for people who want to spend the holidays indoors and maskless with their friends and family?
Well, one option is to make use of rapid tests. We are starting to have some concerns about how well the rapid tests work with Omicron, but at least up until the emergence of Omicron, these have been very potent tools. And remember that Delta does still, at least for now, represent the majority of COVID in the country. So what you can do is get a rapid test first thing in the morning. If it is negative, shed your mask. That is safer, of course, than not using rapid tests, but it's not a perfect tool. So just understand it's safer does not mean it's perfectly safe.
All things to keep in mind. Thank you so much, Dr. Celine Gounder.